Namaste, I'm Dr. Siri. There is a small membranous fibrous structure called hymen at the entrance of the vagina. So the opening at that place is usually narrower than the penis. So whenever there is intercourse, the initial few times it is natural to have pain. But because of the pain, if patients are not able to have intercourse or having painful intercourse, then it may be called as vaginismus. There are different stages of sexual arousal like excitement, plateau, orgasm, and resolution. Here, the patients will have natural stages of this sexual cycle where the arousal is natural but the penetration is not possible. So what is this vaginismus is there is involuntary muscle contractions at the pelvic floor or the pelvis muscles. This is not allowing for a penetration or even a gynecological examination or even tampon insertions. This we have seen lot of couples coming with non-consummation even after 2 or 3 years of marriage. This can really affect the relationships and the life can be very hard for them. So this is a very simple problem which we have to deal with. So once they come with such problems, then we have to see the cause. The causes mostly are unexplained, and some is because of psychological causes, past traumas or fear, or the friends who tell the pain associated with it, and that it is mostly psychological. And sometimes it can be physical, like there could be some trauma or injury there, or they can have some medical conditions like endometriosis which could be causing such painful intercourse. There's a lot of information now available for everyone. There's always here too from their friends who give a lot of feedback about the sexual intercourse and a lot of googling happening about it. So there's already some preconceived ideas and fears and about the pain associated with the first intercourse or the subsequent few intercourses and all that. So definitely a lot of it is psychological, and very little I could say is the physical cause for pain during intercourse. After kids, definitely the hymen would have broken, the vagina would have become a little more lax, and the intercourse is much more easier. But if it is causing pain even after a childbirth, it could be that there could have been some tears in the vagina or in the suturing or some kind of trauma at birth, which could be one of the causes. Or there could be a newfound disease like endometriosis, or even there could be an infection, vaginal infection, which can cause intercourse to be more painful and burning and discomfort. PCOS is a hormonal imbalance that will not cause any kind of discomfort or pain during intercourse, but a very small percentage of a retroverted uterus or a backward tilted uterus can cause sometimes pain or discomfort during intercourse, and sometimes endometriosis where the uterus is adherent posteriorly. In that case, an intercourse can be discomfort or painful to some extent. The intercourse previously which was not painful now is becoming painful is a sign of newborn disease, which could be a very simple infection, vaginal infection, or pelvic inflammatory disease, or it could be endometriosis or adenomyosis, which could be bringing about the pain during intercourse. Definitely for that you have to consult gynecologist who will be able to examine and tell you the exact cause for the reason behind this pain during intercourse, or what we call as dyspareunia. So an ultrasound will definitely tell us if there is any endometriosis or adenomyosis, or if the uterus is retroverted, or if there is any signs of pelvic inflammatory diseases. And once we examine as doctors, we will know how the hymen is or how the vagina is there any infections or is there any tears which could be causing any discomfort, or any nodules like endometriosis in the vagina which could be causing. And definitely seeing a consultant will help you know whether what is the cause for such pain. As I said, a lot of cause for this vaginismus could be psychological. So the first and foremost would be some counseling and understanding of the whole procedure with probably a model will help the patient understand what a hymen is and what it means to break the hymen and why there is a bleed, because a certain amount of bleed that happens because of the tearing can bring about a lot of anxiety and fear in the patient. So once they're educated, they can forgo this fear and they'll be more prepared for this event, and at the same time understanding the position of intercourse and the anatomy of how tilted is the pelvis and what will be more comfortable to start off with. So education is very much important. And secondly, there are some physical exercises, like we ask the pelvic floor muscles to be relaxed and contracted, which will train the muscles of the pelvis to relax also. And also there is something called cognitive behavior therapy and exposure to the serial dilators. So we train the patient and the husband to use serial dilators and use of some numbing creams which will ease them and take the tension away, so that slowly the vaginal opening will be dilated using dilators, and then they can start doing the having normal intercourse. Also, if all these fail, there is something called Botox for vaginismus, where we give injection to relax the muscles, pelvic floor muscles, and they can easily get over this vaginismus problem.